For me, after reading some of the literature on how often people get their mental health needs done with their primary care provider and how much is lost through that link between primary care and specialty mental health, being the people to get there first, to catch them before they slip through the cracks, for me was something that was very interesting to me. So to be able to be a part of that was important. For me, it was the primary care program. That's an interest of mine. Health psychology is an interest of mine. And being able to start off doing some work with Dr. Chris Newman, who's the program director, whether with research and just getting some clinical opportunities to do some clinical shadowing in the community of different primary care clinics. As a first-year student, that was very beneficial to say, okay, this is really what I want to do after getting to see it. During my second rotation in practicum, I worked primarily with dementia patients, and they can be a whole other dimension on their own. And I think walking into the unit, and I had a patient come up to me and just kind of grab my hand and sit with me, and just really appreciated someone taking the time to come sit down and just be with them, whether it was just sitting, not even saying anything at all, just being present with them. And I think that moment for me kind of did it and said, okay, this is why I'm studying this. This is why I'm doing this. Our school has a training clinic, the Robert J. MURNEY Clinic, which is a community mental health center near downtown Springfield, and you get wonderful training and just a nice generalist approach, so you get to see everything there. And then I went to my more specialty rotations at an inpatient geropsych unit, as well as now I'm at the VA health system doing primary care psychology. So it's been absolutely amazing clinical experiences. It definitely puts what you read and what you learn in class into practice. You know, we read about it, we get to see it, you know, observing others, but when you're really there in it, it makes it more beneficial and meaningful as a student. I was a part of student council during my first and second years here, and during my second year we were able to get students into a primary care provider here in Springfield. And so I know that was very helpful to a lot of students, including myself, being able to have access to health care, which for a lot of students, paying insurance premiums can be quite pricey. So for able to have that relationship with Forrest and the health center here in Springfield, that was great to be a part of that.